A career in regulatory affairs involves with complex and fascinating regulatory processes that are designed to protect the public by ensuring that all new medicines are safe and effective.
Wherein pharmacists work as regulatory pharmacists in both the private and public sectors, specifically in all stages of development and marketing of drugs.
They are responsible for obtaining authorizations of medicines for uses in clinical trials, subsequently for registration and marketing, and then post-approval.
They also act as the link between the company and the local regulatory authorities on matters relating to the quality, safety, and efficacy issues of drugs.
Pharmacists work as regulatory scientists or drug evaluators of the new medicinal products for marketing approval globally.
National University offers the course of BS Pharmacy under College of Allied Health for 4 years.
Graduates' expected career path includes community pharmacy, wholesale pharmacy,
hospital pharmacy, and industrial pharmacy.
Lastly, the academic pharmacy.
Our future is sure in pharmacy, and together we learn for the greater pattern.
National University, education that works. Good day, ma'am. We are delighted to have you here with us today. We are Group 5, students of Ms. Hernandez in Perspective and Pharmacy, and we're going to ask you some informative questions in relation to your profession. But before that, could you give us a short introduction about yourself as we start the formal interview?
So I work as a regulatory affairs specialist for CleanChoice Inc. So it's basically a CRO or a clinical research organization, more of pharmaceutical industry related yung services na pinaprovide namin. And I'm originally from Bicol and I'm into arts and crafts.
Okay po ma'am, thank you. The first set of questions po is about your educational background when taking your professional course. So first question po, what is your educational background as a regulatory affairs specialist?
I took up a 4-year degree, the usual 4-year degree of BS Pharmacy at University of Santa Tomas. Yung regular na 4-year degree lang.
Okay po, after finishing your studies po, how did you prepare yourself in applying for the job po?
So, applying for the job, since I took the board exam early, I did not have my certificate yet, but I mostly read on field that I'm interested in. Since I had my certificate early, I tried to enjoy it while I can because when you start working, you don't have that much time. Pero at the same time, I do read anything related with the field that I'm interested. Let's say if you're interested in clinical pharmacy, I do read anything related or what can I find articles about clinical pharmacy or hospital pharmacy. And as nerd as it sounds, naalala ko, nag-try akong bumili ng libro for the IQ exam. If alam niyo yung mga IQ test na nabili sa journal, I did buy one of those books just to parang a refresher for myself kasi pag nag-apply kayo, for sure kasama yung mga IQ tests na ganon. So
effective naman po ma'am.
Minsan halos same siya sa magiging exam mo sa companies. Not sure if ganun pa din ngayon, pero yun, nag-try ako magbasa ng mga IQ test because just to refresh myself kasi parang back to basics yun eh. I do read yung company mission vision nung ina-applyan ko. And from there, try to find something na mag-resonate sa'yo. So, para pag in-interview ka, prepared ka din at the same time.
Okay po ma'am. What about po your merits and accomplishments?
Yung product launch ng mga register ko na product, basically yung baby flow Yun yung mga naalala ko nung first year ko sa regulatory. Mostly baby flow products, clean alcohol, ganyan,
Okay.
clean spray, gano'n. So, yun yung mga naalala ko. So, yun yung accomplishment ko, and at the same time, yung sa latest work ko was launching ng bagong gamot for atopic dermatitis.
Thank you for your answers. Now we're going for the next set of questions to be asked by Ms. Gutad. Thank you po.
Hi, ma'am. Good evening po. I'm
Evening.
Frances. And for my question po, ma'am, before applying as a regulatory affairs specialist, what is your really preferred area of practice in pharmacy po?
Ang preferred ko talaga actually was yung regulatory pharmacy or pharmacist. But before ako naging regulatory pharmacist, I was a hospital or clinical pharmacist first. Medyo matagal din ako doon for some time. And then, ayun, nag-shift ako to regulatory.
So, parang ang calling mo talaga, ma'am, regulatory talaga.
Interesting kasi siya for me. It's different from the usual hospi. Mas gusto ko yung, siguro nung college kasi, parang merong community pharmacy, merong hospital pharmacy, tapos may manufacturing. And pero yung manufacturing natin is more of like yung manufacturing talaga mismo. So, during college pa lang, mas interested ako sa manufacturing. Tapos secondary yung hospital. So, nung pagka-graduate, since hindi ako makahanap ng manufacturing related or regulatory related, I end up taking hospital work or hospital pharmacy. And then when I got to change or look for another job, I tried to pursue regulatory pharmacy.
Okay, ma'am. For my last question po, when practicing the pharmacy profession, what instances have you faced a difficult problem and what did you do to solve them?
Siguro marami siya, no? So, one was during pandemic because during pandemic, health authority, your HA, at the same time, yung embassies are closed. But at the same time, you still have to apply for registration of drugs, and at the same time, you have to maintain the life cycle ng gamot. If you don't, we will be pulled out with the market. So you have to ensure na your license is valid during that time, pandemic. And at the same time, there's enough supply for that one. And maliban dun sa pandemic, I think ang nare-recall ko was more of like, pag may product na gustong i-launch, the market, you're interacting kasi with different departments. They want to have certain claims, pero you have to like, test to them na ganito yung regulations, hindi pwede to. So you have to convince them na ito lang yung pwede kasi ito yung nasa regulations. So, yun yung mga instances na mahirap kasi you have to convince yung marketing team or yung brand manager for that one na ito yung pwede lang natin gawin for this product.
Okay, ma'am. Thank you po. Sobrang hectic po pala nun.
Thank you.
For the next set of questions po, si Mr. Atienza na po yung magtatanong.
Good evening po, ma'am. I'm Sean Thomas Yachenza po. Sa tingin niyo po, ma'am, ano po yung pinagkaiba ng regulatory affairs specialist po sa ibang pharmaceutical courses po?
For this one, ito yung nasa behind the scenes ka. You're not technically in front or one of the frontliners like hospital pharmacist or like community pharmacist. Kasi diba, pag sinabi mong pharmacist, not everyone knows kung ano yung trabaho natin as pharmacist. And technically, yung unang impression nila is like yung sa Mercury or kaya yung sa hospital. They don't know na yung meron pang involved when it comes to pag-register ng gamot or like nag-ensure ng manufacturing ng gamot. So, more of like you're behind the scenes and you ensure na safe and effective yung gamot before it reaches the market. And ang isa pang difference siguro ng regulatory pharmacist, you get to wear different hats. If you get to, if, di ba may mga marketing subjects kayo, ganon and all, so doon siya magiging applicable kasi you deal with marketing department, you deal with different departments. Kasi you have to know how to market the product and at the same time, how to like, nami-meet niyo ba yung requirements ng regulation. So medyo iba-ibang hats yung wini-wear mo while you're practicing regulatory pharmacy.
Opo, akala po nila taga-benta lang po ng gamot sa Mercury. Thank you po.
Yun yung usual.
For the po ma'am, next question po. What regulations cover the most range of medicines po that are needed to be observed po?
For me, yung pinaka-basic is yung GMP, good manufacturing practice, because yun doon nagsisimula lahat. You have to know or you have to ensure that the drug itself is being manufactured safe and of quality. Kasi if not, it will affect yung product itself. So that's one. And the second one will probably yung reporting or safety ng gamot, yung mga pharmacovigilance. Because if yung vaccines, yung katulad ng COVID vaccine, let's say yung COVID vaccine, nilabas siya sa market on an emergency authorization use. So technically, hindi pa siya approved, right? Just in-approve lang siya for the meantime because we have this scenario or we have this pandemic. So, di ba lahat in-injectan nun? Pero nung in-injectan kayo ng vaccine, for sure may mga nakaramdam na kung medyo sumakit yung ulo, inaantok, or mabigat yung dito. And alam ko nga yung iba, may ibang country na may ibang report. So, siguro mas maganda kung mahigpit yung reporting for that one kasi technically kailangan mo ensure yung safety ng mga tao in the community. And at the same time, kung walang magre-report or walang nagre-report, hindi natin malalaman kung safe yung gamot. So, mas maganda kung mas mahigpit yung regulations for reporting. Kasi, for sure, nung nagbakuna, parang feeling ko lang hindi kasi ako nakita masyado ng report. Parang wala akong masyadong reporting nakita. So, mas maganda if mahigpit siya kasi pag mas marami yung trigger for this certain effects, it's one way para ma-call out yung attention ng manufacturer to revisit yung formulations nila kung bakit may ganong effect.
Thank you po ma'am for the answer po. Alright po. I will now give the floor po to Ms. Lagare.
Hello po, ma'am. Good evening po. I'm Christian Faith Lagare po. May we know po the available opportunities in this field that can lead to career advancements po?
In the Philippine setting kasi, we tend to be like more of a generalist for regulatory pharmacy, especially if you're working with certain companies na hindi ganun kalaki. So, you assume different roles at the same time. So, while you're a regulatory pharmacist, you also do like quality assurance or PV roles. So, the opportunity I see is siguro more of like, pag pumunta ka sa ibang countries, they have like, malaki pa yung scope ng regulatory pharmacy kasi they do CMC and that's your controlled manufacturing, chemical manufacturing. It's more of like the manufacturing process and control. So, yun yung konti pa lang na practice dito sa Philippines. So, mas maganda if maraming ganon. Kasi yun yung feeling ko na wala masyado dito sa Philippines.
Last questions po, ma'am. What advice can you give to students na gusto po i-pursue yung pagiging regulatory affairs in pharmacy po?
For regulatory pharmacists, I think you have to develop certain soft skills. One of them is creative thinking and siguro strategical thinking. And at the same time, you keep keep abreast with the regulations. They can be very like strict, ganon. So parang marami kang need na i-meet and all that. Not all time mamimit mo yung certain requirements or certain documents. So you have to think of a way para ma-meet or ma-satisfy yung criteria ng HA mo or ng health authority. And then you have to be updated with the regulations because they are always changing yung mga regulations.
Okay po, ma'am.
It's Fast Talk po, ma'am. Hi, I'm Alistair po and here to interview you. So, shall we start in po? Hardest subject in the pharmacy school nyo po?
Physical pharmacy.
Ma'am, how about the 3 medications that you work in your company po?
It's Xeljanz, abrocitinib, and azithromycin.
Alright po. So, yung next po is preferred procedure po when doing your profession po.
More of interacting with or more of like sourcing yung documents from other supplier, other HA.
Okay po, ma'am. Yung next po is one pharmaceutical company po na ma-recommend nyo for job outlook.
Pfizer comes into mind for me kasi they are my client in my company. It's Pfizer, sila yung client ko. And their vision kind of resonates with me kasi. So it's breaking through science and changing lives. So they are more of like into developing a lot of medicine to help yung to address the rare diseases. So they're the first thing that comes in my mind. Pero I also recommend, especially for those who will graduate, kasi medyo mahirap mag-apply sa mga multi-companies for sure. Medyo cutthroat. Any company, find company that has a mission vision that resonates with you. Kasi when you're working, medyo it takes it's very hard na pag nag-work kayo. It's like you're on the job all the time. And at the same time, may pressure and stress. So, find a company where yung mission and vision nila and at the same time, their values resonates with you. Because when you are burnout or na-stress kayo, it's one thing na babalikan nyo. Like, bakit ko ba ito sinimulan from the very start? So, if your job is fulfilling you, it will help you stay in that company for the long run.
Thank you naman po, ma'am, sa insight. And ma'am, lastly po, yung one person po who inspire you to continue your profession po.
One person that resonates with me, she's the first mentor that I've worked with. It's Ma'am Mitch Villena. I work with her in the hospital because during my stint dun sa hospital, she helped me a lot and she helped me with everything dun sa hospital. So she's the first person that comes into my mind.
Thank you po, ma'am, for sharing your experiences po and the pharmacy profession in regulatory affairs. Thank you po and God bless po.
Lang, ma'am. Thank you po for your
ma'am.
time. Thank you, ma'am.
Po.
Thank you. Good night and good
Night po.
luck.
Bye-bye po.
Bye-bye po.